Good try. Good try. So,
You
okay,
don't get
here
if you
we
don't
go.
ask, you know?
I don't blame you. If you don't ask, you don't try. Of course. Absolutely. I would always ask. Anyway, and I don't mind that. So here we are. We're going on week 2 now. And now we're going into preschoolers, school age, and adolescents. Remember, next week you'll have again another quiz, right? And also you're going to have some NCLEX questions due. I'm going to be putting out a exam review of all the professors that you're going to be seeing. Let me tell you what I know about it right now, what I've seen done. Give me 1 second. I'll look it up. Where is it? There we go. So we have some of them that are going to be done on Mondays, some are Tuesdays, some are Wednesdays, some are Thursday. And what they did is they looked at that thing I sent you, that link on what a day and time was, and we followed it. I believe, what did I do mine? I think Wednesday was the day at 4 o'clock was a good day that I saw many students wanted. Remember, I record them all. They're all recorded, and I'll put it in one announcement. It'll say exam one review recordings, and everybody's will be in one place. There's 5 of us. You want 5 announcements? You don't have time to be looking. So I put it in one place. I'm also going to be sending out all the codes, and I'm also going to be sending out the study guide by Friday. So you have all of it so you can start looking at it. Your exam is week 4, but next week starts the reviews. Now, does anybody have problems with dosage calculation? Does anybody need help with it? If you do, I want you to know I'm very good at it and I can help. I will be sending you out a example type questions that you're going to see on exam 1. If you can do those questions, you're going to see similar questions, different numbers, etc., but the same concept of questions is going to be there. So if you could do that, you're golden. If you cannot, send me a message. Let's meet on Zoom, half an hour. I don't need a lot of your time, and we can review it and help you to
Hello?
understand. There is no reason for
I'm muted.
anybody to be able to get any of those questions wrong. It should be a given that those 10 points are yours in math. And I want to make sure of that, okay? So, what are we going to do today? Yes.
Most of the dosage calculations I can do pretty well. That's not an issue. What sometimes kind of confuses me is like the given divided by what I have times what the doctor ordered or something like that. That
Uh-huh.
confuses me. Sometimes I'll put the numbers in places where they don't go. So if you could
Okay.
send me that study guide and I could go over
I'm
it,
going to
I would
send it to
appreciate it.
everybody. You
Thank
do them. You're having problems picking out the right numbers,
you.
give me 20 minutes. That's all I need with you or less. I can help you. I don't
Mm-hmm.
want to see any math wrong because
Okay.
that should be your 10 points on an exam. Okay?
Okay.
Okay,
Thank you.
awesome. Welcome for sure. So we're going to be doing our PowerPoint, which you have, and I will be doing a Kahoots, which you will be getting the link after class today. Okay. I send out those the recordings. Oh, by 7 o'clock tonight,
Yeah.
8, 9
You
o'clock
see
tonight,
Lucy sending
you'll have them.
the test, the quiz, right? You think
Excuse
she
me.
probably gonna change it because
Oh, somebody had their mute off. Okay.
oh my god.
I have security alert. It's okay.
I know I wasn't muted.
It's okay, madam.
I just did. I muted. I'm
Why doesn't it want me to open it? All right, let me do something. I'm going to open up a different PowerPoint. Give me 1 second, I'll get to it.
Excuse me, I have a question. Is the hurricane supposed to hit tonight or tomorrow morning?
Tonight into tomorrow.
Okay, okay, got it.
And
Thank
that's West Coast coming over to the East Coast.
you. Hmm.
It's
Hmm.
supposed to be around 8 p.m.
Okay, all right. Thank you.
You are welcome. All right, let's try that again. Hmm. Where does this want to go? Give me a second. I had a glitch in my computer. I don't know what was going on, but it's okay. And it's not letting me change this. All right, give me 1 more second. Sorry, guys. Computer is being absolutely crazy today, and I apologize. I think we'll be okay now.
It's okay.
No, I took it over to the Geek Squad yesterday. Some things were going on, and I don't know. He touched some controls, and it's not working the way I normally do it, but it's all right. We'll figure it out. We'll work with it, and that's all that matters. Can everybody see that? All right, here we go. So, preschoolers, we make sure that we're on record. That would be the thing that's the most important. Yes. So here we are going over the preschoolers. This is chapter 18. What are preschoolers? They say their age is about 3 to 5. And, we're talking about infants. They grew really quick, didn't they? Well,
Mm-hmm.
toddlers, they're going to slow down, and so do preschoolers, okay? But now they start to get more mature. Their movements are getting better. They are refining, the way they react with people, the way that they think, okay? They're getting ready for school. They can tell us what they want now. As toddlers, they got frustrated, right? They can't express themselves. But now preschoolers can now tell you what they want. And you don't have to say, I don't understand. Could you show me or what's going on here, right? And let me tell you, they remember everything. Their memory is really well. They also play. They can play with other children. They can share now. They're potty trained and they can sit in school as in up to preschool and they can start to be able to pay that attention span does increase. And they're not as much as mommy leaves and they scream and cry as do the younger children. So these are the things about children, 3, 4, 5 year olds. Well, we know as they get older, they're going to be becoming more mature, be able to do more things. So their language, they're starting getting more as they get older. Their vocabulary gets better, and they're starting to ask
Mhm.
questions about the world. They want to know why,
Mhm.
how. And as parents, this can be so frustrating, but we need to answer these things or show those things. Socially, that fear of, bleeding out, it's not going to be as much. They just go run and get the band aid themselves by 5 years old, right? Understanding. First of all, they were that selfish child and they didn't understand sharing and that caring. But as they get up to that 5 year old, they're understanding more. You give a child who's 3, they might play a game on your cell phone, but by 5, they know how to download the app and up the game and play it better than I do. So their cognition is getting really, really well physically. As a 3 year old, they're very wobbly and falling down and they're running and jumping, but still they're awkward. Well, as they get up to 5 year olds, they're riding at least a tricycle, if not a bicycle, training wheels, maybe no training wheels. And now they're able to, like, take a screwdriver. My grandson, take the back of a toy, unscrew the battery, go find the batteries, put them in, screw it back in, and that's, learning again. Remember, these babies born hardly know how to suck, swallow, and breathe. Now they're using hammers and screwdrivers and they're able to do things where they couldn't before. So it's quite amazing. Physically, as I said, they're getting more and more types of play. Well, toddlers, remember, parallel play, which means this is mine, that's yours. Don't touch mine. It's mine. If not, there's going to be a fight and they're going to rip that toy out of the other kid's hand. As preschoolers, now they're sharing and they're playing within each other. Not necessarily, that's called associative play. They're not necessarily cooperative yet, which means there's a goal in the end, but it could be. Let's get together, 2 or more children. Let's build a house out of these Legos. Or we're at the beach. Let's build a sandcastle.
Yeah, that's
That
it.
is a goal. That's cooperative play. They're
Oh,
absolutely associative play because they're all playing together and they're all sharing. So that is the differences in play.
so what would be associative play, Professor?
They're just playing together with bunches of stuff, but they're not like making a house. They're all like maybe doing something together, but there's no goal. It's not like checkers. Somebody wins.
Okay.
Something that it's the end of that. They just keep playing with the toys and talking to each other, but there's not the house built
So
with a
they're
flag on top.
separate toys for separate children, but they're all together, but not really playing together.
They can play together, but there's not a
They're
goal.
playing together. Okay, there's not a goal. Okay.
Cooperative play, there's like checkers, there's somebody wins. Or
Okay.
cooperative play, get together and let's put the train track together and let's, drive the cars around. That would be cooperative play. There is a
Gotcha.
goal in the end.
Okay.
Now, Piaget thinking, right? These children, at first, they don't even know that you shake a rattle and it makes noise, right? And then all of a sudden, they know how to do these things. It gets up to the point where now they're starting to, their mind is thinking a lot more. We know their language is getting better. And that symbolic functioning, what is that? Taking a broom and riding around like a horsey, putting your arms out and going around, and now you're an airplane. That symbolic functioning. Egocentristic, again, they're not just seeing themselves, they're starting to understand other children a lot more than they were as a toddler. Now, animism, they believe their toys are alive. Their teddy bears are alive, right? It's like the little girls sitting down with the animals having tea. They're all going to drink the tea with them. They give them life to the toys. They have them Spider-Man flying in the air and they give them life, okay? And feelings and not just that they're inanimate objects like toys, okay? Now, artificialism is things like the wind is blowing because somebody's blowing hard. Or I used to hear when the thunder came and lightning, God was bowling, right? These are things that are nature, but we give them some sort of,
Explanation.
yeah, like why and how does that happen? It's like the clouds are white because somebody painted them. This is all now. They're starting to think. Now, the intuitive thought process, again, this is using symbols to represent words and stuff. Again, this is like the stick and the horsey and the not, the stick and the sword and the arms and the airplanes. Again, they're starting to take these things and make them into something to play with. I mean, you can put a kid with a cardboard box and they can do so many things with it. I used to say, why do I buy toys? Let's just give them a box. They can play with that the best, right? And it was cheap. They also um, have a tendency to look at one feature of an object. Maybe it's the hair on a doll, or maybe it's the Spider-Man's wrist is what we're going to look about. Whether it's not really Spider-Man, maybe it's the teddy bear they made into Spider-Man, and they're starting to, that's what they're thinking about. And it could be anything like that. Now, sometimes children don't speak the way they should. Now, the first thing that I would always check if a child does not have good speech is can they hear? Because hearing and speech are always connected. So it could be physiologic. And usually it's let's rule out hearing first, and then let's work out things like brain damage. I've actually had a friend whose daughter didn't speak, and then after they did a bunch of workup, they found out this poor little girl had a stroke at birth on her speech center. So she doesn't speak at all. So now she's now a teenager, but she has a pad where she can express, and of course she's learned sign language and all of those things. But it was a real physiologic problem. Sometimes it's that psychological and they don't want to speak. It could be an anxiety disorder. It could be autistic, right? Children or cognitively delayed in some point. And again, this is something that what do we do? Whether it's from infections, drugs, poverty, malnutrition will affect anything. Their cognitive development is delayed. And that does include speech and paying attention because they just don't know how because their brain wasn't given the food that they need. What do we do when you have a language problem? Well, we're going to start early intervention and let's give them some speech therapy after we ruled out all the reasons why a child maybe doesn't hear or speak that well.
Before you move on,
Now,
Professor, could I give you a testimony of what you're saying is so true? Yeah, my son is autistic, but he's 12 now. And yes, he had speech delay, behavior, all of that. But it's as I said, I don't even know one is on here that have a child like that. It's very good not to give up on them or to give them over. Just, bear grind because I cry a lot and went through. But he's much better now because he go to speech therapy. He's an A student at his school. He's in the magnet program, advanced program, and he's doing excellent. So I just want to tell you that
That's good.
once they get the proper teaching and
Early intervention
prevention,
catches
right?
them up so quickly. And you're
Yeah,
right, don't give up on them. Don't
yeah,
give up them.
yeah.
Most of
No,
my
excellent.
clients are adults with autism. And just last year, we had a girl say four different colors, and she was 32, and they'd been working on that for like 5 or 6 years. So any success is success.
That is
If
a success story.
if she would have started when she was a kid, I think that she could have been a lot farther than she is now. But just being able to get purple, green, blue, and orange
That's a big
in
thing.
Because the
6 days.
doctor asked me to let my son stay because he saw me crying, when I found out at an early stage. And he said, "You want me to put him into child's care, like children and family stuff?" And I said, "No, I will suffer with him." And I'm so proud of him.
That's
Very
good.
proud.
Yep, that's quite amazing. And,
Professor,
and then you have the other side of that where the child is autistic. And this is my oldest grandson who was never diagnosed until 2 years ago, and he's 12. And the only thing that kept, and he's an A student, brilliant, reads books, he's amazing, but it's the behavior. He has outbursts, he doesn't know how to express themselves. The light switch turns off, and you cannot reach him. If he could have, I mean, his mother gave him a lot of interventions, and those interventions, yeah, got him where he is today. But an earlier diagnosis would have given him a lot more.
Yeah, it's true because
So,
my son used to break up his laptop, break stuff, thump the wall. And
oh,
then,
yes,
I used to cry because I don't know what is because my other kids, I didn't have any problem. So when
right.
I took him in like about 2, 3 years old or so, that's when they found out. And then I had to accept it. And then I just ran on everything that they offer. I take it, I work with it, because I just wanted him.
No, absolutely. No, thank you so much for saying and sharing that. And yeah, autistic children can be difficult to work with those little steps. Like you said, Jessica, they're so rewarding. Sometimes, I mean, even I, as growing up, and I used to teach these children swimming when I was in high school, and just to have them hold my hands like this and then go to the deep end, and they were afraid of the water, but to trust me, to kick their feet and just to hold my hands as I was on my back, they kick to get them up to the deep end was the most rewarding thing for me. And I think it's one of the reasons why eventually I did go into pediatrics because of these children. So thank you so much.
Professor, I have I think it's a flip side to that too. Like sometimes we'll try to diagnose things and we're like, okay, well, I'm not getting responses from him, or he's not talking, she's not talking. I think they have autism. Let me take them to pediatrics and get them diagnosed. What I've learned is that some children are shy and a bit bashful, but some children just don't talk because they don't want to talk. My nephew was like this. He would not open his mouth for nothing. He would always point to what it was that he wanted. So my sister-in-law, because our boyfriends are brothers, so my sister-in-law, she took him to pediatrics because she thought something was wrong with her child. So the doctor told him, the doctor said, no, nothing is wrong with him. Just leave him alone. He'll talk when he's ready to talk. So this is the age of 2 or 3. He did not talk until he was 6 years old. And the doctor
And now
told
you
her, he
can't keep
said,
them quiet.
right. The doctor told her, the doctor said he will talk when he's ready to talk. So it was like a normal day for her. Again, he sits, she's in the kitchen cooking. He walks up to her and he taps her. He's like, Mommy, can I have a snack? Mind you, this boy ain't said nothing, no mama, no dad, no nothing since he was born. She screamed on the phone. She went crazy. She was like, my baby can talk. And I was like, well, yeah, the doctor did tell you, leave him alone. He'll talk when he's ready to talk. I think that's the kind of flip side to it. Just because your child is quiet, of course you want to get them correctly diagnosed, but don't automatically assume anything.
Exactly,
Sometimes
exactly.
children, they just come out of their shell when they're ready to. My daughter, she would talk at home, but she would not talk. My baby, she would not talk when she was at school. She would sit in the corner and she would play by herself up until month about 6, maybe 7. the teacher was cutting out numbers and letters, and my daughter walked out of the corner. She walked up to the teacher and she was like, is that letter, or that's a number? And the teacher said, it's a letter, like this letter is M for Malaysia, because that's my daughter's name. And my baby said, oh, okay. And she started interacting with the teacher and the children. I think it was just that whole, mommy's not here with me and I don't know you people, I'm in a room full of strangers, and
You
she
mean the
felt some type of
separation
way.
anxiety that
Yes,
we're talking about
exactly.
next?
Exactly. And she
Absolutely.
didn't feel comfortable with them. It's like she always wanted me. She couldn't wait to come home with me. But it's like now she has friends, and kind of like that whole, I'm getting used to the separation thing. I don't want you anymore. Like,
It's a
go away,
form of
mom. You
trust.
good?
They have to trust you.
Yeah.
Yeah, because
Yeah.
my
It's
Hmm.
like
son,
go
yeah,
away.
it's a
Like she don't
trust.
really need me no more. Now she want her friends and
Yeah.
she want her teacher, and it's
Yeah,
crazy. But
because
yeah,
my son
that's
have that.
all.
Once he move into a different class, I have to, even because he's in middle school and he's an advanced class because he's smart. But even going to a next class, they have to have me come to meet the teacher with him. And then he look up to me and I said, yes, she's good. And he look up back at the teacher and he said, okay, ma, okay, okay. And he's 12 years old, but they have to learn to trust. It's a
Yeah.
form
And
of
it's,
trust.
Yeah.
and each case is different, like you're
Yeah.
saying, and again, it's not giving up on a child, and it's
Mm-hmm.
also understanding. And your sister did the right thing. She went to the
Yeah.
doctor to find out there was no reason why,
Right.
and you, Karen, you got the diagnosis, and then you knew what to work, and you took whatever help you could. So again, it's a good parent backup on a child can work wonders. Sometimes it's waiting, and sometimes it's going full force ahead and getting whatever they need. So,
Mm-hmm.
thank you for those
Yeah,
stories. Yes,
yeah.
absolutely. And I
No
totally
Don't
problem.
give up.
understand.
I still have issues because sometimes I'm up here and I have hear him up there giving. I have to just step away to calm it down
No,
because
I understand. You told
yeah.
me. I'm okay with it. Okay, so hospitalization and children
True, me don't
can
have
be
problem
one
getting
of the
in.
scariest things that can be, right? So these children, um, some of them, and believe it or not, it's not that kid who goes into a hospital just once. It's that kid who's in and out. It could be that sickle cell child, cystic fibrosis, one that are in and out of the hospitals a lot. And you're gonna, they all react differently. So there are different stages of separation anxiety, and you're going to do that discussion question on it. And it just basically says there's protest, despair, and there's detachment. Okay. Now, the protest is what? Screaming and yelling, and I want my mommy, and crying, right? And then all of a sudden they just say, well, she's not coming. And then they go into despair and it probably regress, start sucking their finger, their thumb, or, I'm being incontinent when they're potty trained. And then all of a sudden, depending on the length of time, you might see mom or dad comes back and they don't want to pay attention. They're going to pay more attention to their new best friend. It could be that nursing assistant, that nurse who spends all the time in there. And that's absolutely normal for children. I think you see separation anxiety more like in your toddler and your young preschoolers. You're going to see that. So as you're looking at a preschooler, things to look at because diagnosing autism, Karen, they don't do it till about age 2, because they need them to go through certain things. Now we can have suspicions before that, but we'll never give that diagnosis before that. um, and what we'll do is, how do they play? Are they alone? Are they by themselves? Do they play with children? Do they like the active quiet, again, talking with those children, their playmates, and then attention spans. All of these things will give us clues on the children, to help us take care of them. And again, how do we treat any sort of issue? It's always that early intervention. There's speech, occupational, physical therapy, and those things, all of them work together. And I've seen amazing things with children. I've seen a Downs autistic child who would come into the daycare, who would take off his backpack, put it in the cubby, sit down, wait for vital signs. When he was done and said, okay, then he would go play. How many Downs autistic children do that? It's because of that routine, same routine. same routine, it's what they love. Now, bedtime habits. You know, young kids, especially that, your toddler preschoolers, they don't want to go to bed. They don't want to miss a thing, do they? So, what should we do? Quiet activities before they go to bed and a same routine. Maybe it's come on, let's go pick a book out, let's go read. Or, all right, let's watch a little movie together. Um, and when they know that when they start doing those things, it's almost ready for bed. They know that, okay? We know there's going to be attention getting, like, I need another kiss. Daddy can have another kiss. Oh, I have to go to the bathroom. I need a drink of water. I need. And we know that if we always go and we do those things, the kid's always going to be doing those attention getting sort of things. And we know preschoolers, like Goldberg says, reward and punishment, right? We know if they are rewarded or praised for good behavior, they're going to want to do good behaviors. So preschoolers, again, they're not gaining much weight. They're not gaining much height, but just a little bit. They're getting taller and slenderer, and their trunks of their bodies are getting not so long. Their legs and their arms are growing. They're running, they're jumping, they're skipping, and they're hopping. And they should be able to ride a tricycle by about 3 years old. I'm not saying it might not happen earlier. Again, forget you have kids. Know what the book says, okay? It's about 3, maybe they start with tricycles. They're going to figure, are they right-handed or left-handed? Now, with my grandson, he was always using both hands. We had no clue what he was until he started preschool. And we found out he was a true and real lefty, but he used his right hand with many things. Throwing the ball with the right hand, he does better with the left. They can use scissors now by age 4 and tie their own shoelaces at age 5. Now, today, with all those Velcro strap shoes, we don't really use shoelaces until maybe, and my grandson at 7 just learned to do his shoelaces because he didn't have to do it before. Because, these companies make it easy. Velcro straps are easy on the kids and us parents too, right? They're learning colors, shapes, letters, numbers. All of these things they're starting to learn. Their vision is beautiful, perfect, 2020. They are ecocentric and concrete. What does that mean? They do think about themselves, but
It's about them.
others, right? But
Mhm.
they need to see it. So concrete, something you can see and feel and touch. That means I've seen this before, so I can do it. Whether it is you saw another kid get on a tricycle and pedal around, that preschooler who never been on one would know how to get on that tricycle, where to put his feet, and to try. They've seen it, they're going to try to do it. They are sentences, 5 to 8 words. And some of those words are those imaginary words. I always remember the word teleportation. That was Christian's word. Did he really know what it meant back then? I don't know, but it was a great big word. So we never, all right, sure, we're in teleportation today. Okay. Now, they're also now know that they have body parts. Remember, there should be told it's a penis and a vagina. You should use those words, although everybody has their own names, what we use. And we know there's curiosity. At 3 to 5, there is going to be some touching and feeling of their private parts and masturbation. I always say if their hands are in their pants, say, take your hands out of your pants. Does it hurt? Do you have to go to the bathroom? If not, okay, if you want to touch yourself, go to your room. I don't need to be watching. And it doesn't bring attention to that shouldn't be done because later on in life they'll feel like they can't touch themselves. And that's not, we don't want to decrease their curiosity because they're learning what their body is, right? They do have playmates. They're little imaginary playmates that follow them around when they're alone playing with toys. There's going to be somebody with them. That's normal. They do have fears, of the dark is the big one, right? So that aggressiveness, and there are aggressive at 4 years old wanting things, they become now more independent as they get older and older and older. They want to do it by themselves and they want to do it right. And we know Erickson's all about that developing a sense of initiative, which means doing and helping for themselves. And that guilt is when they can't do it right. They want to do it right. So, Freud, anything sexual. You hear anything about sexual, it's Freud. We know that the
He's a
preschooler is
pervert.
all about their body parts. It's all about their girl parts and their boy parts, right? Just that. Erickson, I just discussed about it. Again, when let's say they do something and they do it wrong and you criticize them, now they feel guilt. They don't feel like they did it right and like, I'm not even going to try because I don't do it good. And that's the way they'll feel with everything as they get older. Piaget, now they're starting to understand things more. But remember, they have to see it first to be able to reproduce it. And what is this feeling of conservation? Well, they're starting to understand if you have 5 pennies and you line them up on top of each other, and then you have 5 pennies and you put two and two and one looks smaller than the other looks taller. They're going to realize they're both 5 pennies. Or a big ball of clay and you smush it, it's still the same amount of clay. They're starting, not quite yet, but they're starting to get there. Again, Kohlberg is reward and punishment. What you can do right, you can do wrong, and there is a consequence. Now, preschoolers, one of the things that they're still going to be doing, many of them, is sucking their thumb. What they say is they try to get them to stop before they get their permanent teeth in. And again, how do you get them to stop? Again, it's that praise, encouragement, good job, right? I had a daughter who liked this finger. I was afraid her teeth were going to be separated and pushed out because she liked that finger. So again, it's not putting hot sauce on it and doing all these crazy things because I've heard all of this stuff. But again, it's that praise, the
Excuse me, Miss
encouragement.
Bogart. I'm
Sure.
not leaving. My baby nose just started bleeding, so I gotta help.
Thumb, finger, hold it, put their head
I'm sorry.
forward.
I'll be
It's
right back.
okay. Go ahead. Take care of your baby. All right, bedwetting. Bedwetting can happen, and it's more common in boys than girls. And there's 2 types of bedwetting. Now, usually most preschoolers are potty trained and they don't urinate at night. So if they are all of a sudden wetting their bed, we need to rule out why. Most common is a urinary tract infection. Okay. We have some children who are not never have been dry yet, and that's okay. We don't have to investigate. But if all of a sudden a baby who's potty trained starts to urinate at bedtime, let's find out. It could be, as I said, urinary tract infection, seizures, diabetes, mellitus diabetes, insipidus, both the signs of these diseases. And we'll do that later as we go on and get into those. One of the signs is urinating a lot. So it could be
Professor,
that.
sorry to cut you off,
Yes.
but before you move on, back home when we used to with wet bed, I was born in Jamaica. I used to push my sister in the bed in the wet, and because you're going to get a beating for the bed wet. But back home, the knowledge that we have now, we didn't say it was all of that. We were just say, you used to get beaten for wetting your bed because, they say you're not supposed to pee your bed. So, back those times was real hard. Or, the mother would don't have that knowledge.
you know, things have changed all along. Honestly, to tell you guys truth, I used to wet my bed up till I was about 8 years old. Not every night, but I did. But my mother was good. All she did was take a nice big towel, put it on top, and say, okay, go to sleep.
I was
Now,
about to say,
there's
according to the
all
School of
different,
Pediatrics, yeah, I'm sorry,
yeah,
Professor, but according to the
all
School
the
of
times.
Pediatrics,
Yeah,
you're supposed to give a child up until the age of 7. I learned that by taking my children to pediatrics. Yeah. I thought they supposed
absolutely.
to
It
have it
can
down
happen.
pat around 3 or 4, but they said no, give them
What
up to
happens when
7.
kids get stressed? This is one of the things that can show stress is that urinating at night,
Hmm.
and I still remember
Trauma
to this
too,
day,
Professor, right?
stress, trauma,
Trauma
any
too.
of that.
Yes.
Yeah.
Yeah. Because I know
You know,
children who have been molested and they were bedwetting, or they had
absolutely.
PTSD from watching a parent get abused and they were scared to get up and go to the bathroom at night. Yeah, trauma too.
Absolutely. I mean, there's so much more in there. Yes,
Mhm.
absolutely.
Okay.
And it could be just, making sure they don't have a lot to drink before they go to bed. I
Hmm.
remember my daddy coming and getting me and
But
putting
there's
me
a
in the
store. I know
bathroom.
we should get cans that we could eat. Say that they're right.
Okay, let's
Ricardo,
keep going.
you.
Well,
I got it.
Professor, can so would we be wrong if you can say, well, maybe it's laziness. They just don't want to get up to go pee?
It could be that too.
They could
Some
be
kids
such
are
deep
lazy.
sleepers that they don't know. I don't know if we would call it laziness. Some kids play so hard all day long, don't, take naps, and they go to sleep and they don't wake up, with a hurricane going on. They just
So at
don't.
11 years old, it's
There's
normal for
something
a
else,
child
but
to be
no,
peeing in the bed?
something else is going on. Something else is going on, and that needs investigation. If they've
Um,
always urinated their bed every night,
I'm investigating every night. Yep, every night.
something's going on. It could be diabetes insipidus, diabetes mellitus, could be something psychological. You don't know. So that's something that does need investigation, finding out what the reason is.
My
Okay.
grandson, he's 11, and he does that. But he stay up all night and play video games. And then once he go to sleep, he's just lazy. He don't want to get up to use the bathroom.
Could be. Could be. I mean, I even
Hmm.
had one of my nephews, he was 10 years old and they still put a pull up on him. And there was no reason for it. And then he outgrew it. But I still remember, like, oh, he has diapers. And I was talking to my brother because they'd come and stay with me, from New York in the summer. And yeah, same thing where, they would put it on. And in the morning, he would just take it off, put it away, and on with the day. But eventually, he did grow out of it. There was no reason for it. So there's many reasons. I mean, you could see that. All right.
You can't come back here no more. You gonna piss up my couch.
You to put a pull up on them. They've got pull ups bigger for like adults. So we have them around now. When I was young, we didn't have those things that big. All we had was cloth diapers, if you can think about how old I am. Anyway,
Hmm.
health promotion. Like, we do start making sure that we're healthy at a very, very young age, right? Remember, they need limits for their behavior. And how do we do discipline? It is timeout, 1 minute per year of age. They
Hmm.
need to be told what they did wrong. The timeout will start when they're quiet, and then the clock will start 1 minute per year of age. Again, reward and punishment at this age is really important. Bribes is not what we do. Okay. It's more of, stroking that good behavior, but not saying, well, if you're good, you can have this or we'll buy you this. No, that doesn't work because they're going to be bad just to be able to get that bribe. And always it is consistency. Always consistent. Kids are smart, let me tell you.
I was
And
just about to say they
preschoolers are.
smart if they know how to do that.
They know how to get everything out of us. They really, really do.
One of my
You know,
clients found out that if she fought hard enough to not get on the bus in the afternoon, her mom would come and pick her up. So she
you see,
knew if she waited more than 10 minutes to get on the bus, her mom would come. And she was six or seven at
yep,
the time.
yep.
They know.
Absolutely. Absolutely. So if we sort of do those things, guess what? The kids will continue. They know, they really, really do. It's like the child who's put in the crib the first time, and mommy wants to sleep and they tell you, let them cry. And what do? We pick them up. So they cry, we pick them up. The next time we put them down, oh, they cry, we pick them up. And that's why they don't ever learn how to sleep in their own room, in their own cribs. This is the sort of behavior, even as infants, they know how to do this. Infants are extremely smart too. So we do have preschool programs. Preschool programs are great. They are structured, and this is a lot of place where children can get feeling good about themselves. Accident prevention. Well, preschoolers are more agile, they move quicker, so we really need to be careful with them. Motor vehicle is the biggest type of accidents, and I'm talking about not in the car seat, it's being outside hit and run over by cars because they don't realize cars are going to move and that they can get run over. I've actually seen 4 different cases of children at around age 3, 4 that were run over by cars. I've seen good outcomes and bad outcomes. So this is somewhere where we really need to teach these children about cars and what can happen and what do they need to do and hold my hand and look both ways, et cetera, et cetera. Because now these kids are going to be on bicycles riding around in the neighborhoods, in the streets, on the sidewalk. Where are they, right? So teaching them. Burns can happen, pulling handles off the pot, or they want to get that piece of food because they're hungry and they burn their mouths, etc. Part of it.
Or playing with wax. I had a patient get burned like that, playing with their mom's wax. And
Oh,
the
yes.
nurses, the burn nurses had to scrub the old skin and stuff off. And, so the new skin could form and put medicine on it. Yeah, the burns is most
Absolutely.
definitely.
We need also always to teach them about getting into cars. That will always be. I mean, my grandson at age 6 was riding his hoverboard and he fell, and a lady saw him and saw him crying and said, "Come on, get in the car. I'll bring you to your mommy." And he said, "Absolutely not. You're a stranger. I don't get in a car like you." But what that lady did, she took his hoverboard, followed him walking to my house, waited with him ringing my doorbell and told what happened and said he wouldn't get in the car because I'm a stranger, but I wanted to make sure he was safe. So of course, I praised the child for doing exactly what he was told. These children are going to be places where we don't see them anymore. It's our and nurses' responsibility to teach our parents to make sure that these children know to teach these kids about all of these different dangers. So school age, ages 6 to 12. This is when we first start getting our permanent teeth in, okay? We are now learning about things. It's not just making up their little fantasy world, right? Yes, we're going to be playing, but playing with learning is the best way with these children. School age is all about same sex peers, right? They're starting to get their best friends, getting their first girlfriends and boyfriends. I'm like, no, it's a little bit early for those things. School and everybody does judge them by their performance. Do you get all A's? I did a project where did you do the best one or did you do one that was not so nice or good? Sense of industry. What does that mean? This is Erickson. Industry is your factory. It's what you do, produce what you do well. Okay? I'm good at spelling. I'm good at running. I am good at playing a piano, whatever it is. I'm good at that. That's my industry. And then Erickson goes on industry versus inferiority. Well, you can't do everything well, can you? So the inferiority is those things I can't do. I might be good at science, but I'm horrible at math. So my industry is science and my inferiority is math. And that's what Erickson says during that. Now they're starting to write, they're reading, and now it's not that instant gratification, that instant reward, and now they can wait for it. It doesn't always happen right away when things are done. It might be that kid doing a project for school and they have to wait till after all the kids hand in a project to get that feeling of, ooh, I did really good, and they can wait for it now. So parents at this point need to understand that children need to be able to try. They not going to always do things right the first, second, or third time, but we have to continue to let them to try. So their GI tract is getting more and more mature. They're more like 3 meals a day. They're not with all the snacks in between. Of course, they have their snacks, but it's more mature. And the other thing about school age children, you have some kids that are young and are look older. My second grandson is 9 years old and weighs 145 pounds. And he looks like a 12-year-old, but his mind is more like a 6-year-old. And you can't treat him like a 12-year-old. He is a 9-year-old child that needs explanations. So again, your size, what you look like doesn't mean that emotionally you're there. That's what that means. So parents and children should together set goals and expectations. They can't all children do the same thing. One kid in the family might be the best reader and like to read books. It doesn't mean the second child's going to do the same. Maybe that child is more about drawing and coloring or those sort of things. With school, one of the things they look at really closely is about being in school and the attendance and being late and teaching them that being on time, going to school is something they're going to have to be doing for life. That they can't just stay home because they don't feel like going to school today. It's really important. So we teach them what they're going to be like later at life when they get a job, right? And they're adults. And homework is not the parents. The parents shouldn't be doing the homework. It needs to be the child. And the child needs to do it as well as they can. Yes, they can ask questions. Yes, you can check it, but they should do it by themselves. That is their responsibility. So their identity, sexuality, again, depends on your family, doesn't it? Where you are in the family and what type of family that you do have. We know that in school, boys tend to be more aggressive than girls. That's just absolutely normal, especially in the school age area. We know that we have girls that like to be with dresses and hair bows, and we have girls who wants to be in jeans and t-shirts. And all of these things, we have to let them be what they're feeling. Okay. Mm-hmm. The other thing is children tend to be with a whole bunch of other children that have different words for things. I've heard all different crazy words I've never heard of. Again, if the child uses a word and you don't understand it, then we should say, so what does that word mean? I mean, I could think it means something else. Sex education should be always. These children, as they get older and they're asking questions, is find out what they're thinking and then answer these questions very simply. We don't have to go into what mommy and daddy does for babies. We could just say they just like to hug each other, whatever is appropriate for the child for what they're asking, okay? As I said, either genitalia, we should use the proper names. I've always done that from the get-go with little Christian, and those words are just normal for him right now. So it's your penis itching you, and like, no, I just, I just wanted to touch it. I'm like, we'll go in the other room again. Always saying things like that, and they do touch themselves by themselves privately, and it's normal. Think about all of us as we get older. These are normal things that happen. They're school age. Yes, they do those things. And there's another critical question. You can look at that by yourself. If you want to do it with me, you just let me know. So growth and development
So,
again.
Professor, I mean, I don't. That's a comfortable conversation to have with a child of that age. To ask him, is his penis itching or something like
Well,
that?
he's
I don't
touching
know. Maybe
himself in
so.
his pants. Does your penis hurt? Or does it hurt, or do you have to go to the bathroom? I mean, it's like, does your arm hurt? Does your elbow hurt? You make it normal. Don't make
I
it
guess
like it's a
maybe it's a
bad
cultural,
word.
maybe it's a
Yeah,
cultural thing.
absolutely. I
Yeah.
agree with
Yeah.
you. Absolutely. I've been yelled at by other students. Yes, I understand it. But it's
No,
like, does your
Okay.
ear hurt when you
my
touch it?
son,
Does
my
your
son
penis
do
hurt,
it.
or is it your balls?
Yeah,
Yeah,
because
I
if
my
I
mean,
ask my
you,
sons
yeah,
that,
my
they'll look
son
at
do
me
it.
like I'm crazy.
I
Yeah.
know that. I understand. But you need to know
Oh,
where they hurt or something's going on, right?
But Paula, as I said, Jonathan do it. And when he do it, I will ask him, I say, Jonathan, is everything okay down there? And he say, yeah, mommy, I was just fixing it. I said, okay.
uh, I guess
Yeah,
I put the heebie-jeebies and the fears in my sons. They never did it in front of me.
yeah. My son do it.
Uh-uh.
I will
Oh, I
say
love it.
that that's how
I
my
love it.
parents were growing up, was like, you don't talk about it, you don't like anything.
That was
But
my
Exactly.
house. That was
that
my
was my
house.
Yeah.
I
upbringing.
Yeah.
understand it.
But
Yeah.
with my daughter, it's a lot more. I didn't know the word penis and vagina till I was like 13 years old. I didn't know that those
That's right.
exist. Uh, and
Absolutely.
unfortunately, things happened to where I couldn't communicate it because I didn't know. So I made it to
Right.
my daughter. She knew the word penis and vagina by the time she was 3, because
Yep.
I didn't want to risk having that happen. So now she's 9, and if she is scratching or something, like, she's got kidney issues, got to worry about UTIs. I'm like, are you itching? Because it could be a lot
Right.
worse if it's anything.
Exactly. Exactly. If you make it like an elbow or an ear, it's not a big deal. And if you
Yeah.
do it young, it's always been the same way. And that's
Yeah.
the way that now the literature says that we should talk. And I understand cultural. I know some don't talk that way, or smack them alongside the head, sort of, you know what I mean? Like, yeah, you ain't doing that in front of me. But,
Professor.
it is a personal choice. Yes.
Professor, I think it's easier too when it's time to have the sex talk when they hit puberty or right before they hit puberty, because some children they're getting pregnant at 12 and
Yes,
13.
they are.
So I think it's easier. It kind of opens that door, because it was like that in my house too. You didn't use those words. You didn't even talk
Oh,
about
I didn't
something
either.
like that.
I didn't
If
either.
you was in pain or whatever, you said, I'm in pain down there, or my pretty thing hurt. You, like you said, there was those little nicknames, right? But I think
Hmm.
it opens the door and it make it easier to have the sex talk. So when we talk about STIs, when we talk about urinary tract infections, when we talk about being inappropriate, the difference between appropriate touch and inappropriate touch, it kind of opens that door, and there's not a milestone there. It's not like, oh God, mommy said this word, ha ha ha, bust out and start laughing and lose your mind. I'm
Right.
already used to that word because that's mommy introduced
Exactly.
that to me at a younger age. So I think
Yes,
it helps
perfect.
too. Now, in my household, of course, we had little nicknames, but the way I'm raising my children is a little bit different. So when it's
We
time to
all
have
do.
those talks, it's like, certain generational curses I broke.
Right.
And
No, thank
so,
you so much for sharing that. Absolutely. That's said very,
yeah,
very well. Perfect.
yeah, it's like it
Okay,
makes it
school
easier.
age. The school age, the children maybe start getting menarche, getting their periods. They're growing up now, right? And all of them are different ages. We know that the loss of their teeth comes in and they're permanent by the end of the school age. Before they become adolescents, they should have all their permanent teeth in. Their fine motor skills, their gross motor skills are all becoming more and more mature. They can write cursive by age 8. They dress themselves. They are stopping thinking only about themselves, and they're aware of other people and other people's feelings. It's not that I have the best this, that. It's saying, yeah, but you've got good things too, making them not feel less than. And I think that's very, very evident in the school age. They know time a lot better. Remember, as preschooler, its time is related to events. They don't know the clock yet. After lunch, when we wake up in the morning, that's preschooler. By school age, they should start to know it's 12 o'clock, noon, daytime, or 12 o'clock, midnight, nighttime. They're starting those things. They understand past, present, and future now. They understand what happened yesterday and what may happen tomorrow. They're understanding if they do something, there's gonna be something that happens, good or bad, depending on what it is. Again, same-sex peers, important. The molars are coming in, right? So all your big teeth are coming, more the permanent. And as I said, Erickson, industry versus inferiority. Industry, my factory, my house, what I produce, what I do well. I'm a good speller. I am a fast runner. Inferiority, can't do it
I'm
all
not so
well.
good at.
I can't do this or I can't do that.
Yeah.
Freud, this is sexuality's talking about same-sex peers. All it says. I told you Erickson, and what does that mean, right? Piaget, the thinking, they only can do concrete things like concrete, what you they have seen, touched, and felt before. If they've seen it before, experienced it before, they know it. They can't think out of that box yet. They can't think for themselves, only what they have learned. And then Kohlberg, this is the good and the bad. No, they want to be the good girl, the good boy. They want to please. That's Kohlberg. Play. Oh, this is the cooperative play. There's always going to be a goal playing together, and there's going to be a goal with
Who
it.
wins?
Okay.
Who
It's the
loses?
sports, all of those things going on, and again, play will always be important. Latchkey kids are more and more today because both parents have to work or single parents. Kids come home, nobody's home. They have a key to the house. They have to let themselves in. Remember, latchkey kids do have a higher rate of accidents only because they're alone. Okay. They can be taught how to use the microwave and make their macaroni and cheese in the microwave, right? But they need to be taught concrete. They need to be taught these things and they can actually be good. But again, there is higher up and they always need to know who to call, who to go to in case of emergency. Health exam. Now we are doing hearing and vision. We're looking at school performance, physical activity, making sure that they are where they should be. Um, if they go to a hospital, again, we don't have to go into as detailed as showing them dolls and pictures. Well, pictures would be good for school age, but we don't have to be as detailed. We can verbally explain a lot more. The younger kids need more of that visual, right? School, they always need after school. You come home from school, you get a snack, change your clothes, get your homework done, then you can go play. They always need, where am I going to study? It doesn't, if they don't know where their study place is, it's been proven that if they have that one desk, that one place set up for their school and doing schoolwork, they'll get it done a lot better because they're not looking for a place to go with their computer or their books or those sort of things. And school age children need responsibility for their pens and pencils and their computers and their books and making sure they don't lose them, give them away, et cetera, right? They really need responsibility. Having a pet is a good thing. We know that pets do have risks. Making sure those pets do have, seen by the vet and have their immunizations themselves too, because they are dirty and they can transmit diseases. We do know that pets are extremely beneficial. Especially children with disabilities. There's something about that comfort of a cat or a dog crawling up and next to them and licking them, and they derive this sense of love and feeling. It's a good thing. I mean, pet therapy is big in hospitals today. At my children's hospital where I've worked, they have pet therapy, and the kids love it. And
My
we
dog
know
is on
that,
puppy brigade at our local hospital.
yep, it's amazing. And they do love it. And you'll see kids, parents, everybody following these kits around. Now, what determines pet ownership? Well, Christian, just back in May, Daddy decided to bring a cat home from a client and brought it to the house and said it would be a great thing. Brought it into the house, and my daughter's allergies went bonkers. So they were like, we got to get rid of the cat. And I'm like, well, I don't want it. My husband has asthma and he's had status asthmaticus. No, we can't have it. So they did all the things, the powdered shampoos and the foods, making sure it was as less allergenic as possible, right? So again, showing how to wash hands. Again, showing them how to deal with litter boxes and all of the feces and licking them in the face and the mouth and all of these things. I mean, we know pets are going to lick us all over. It's not a great thing. We know that we can exchange diseases with it. So, and there's other things they say, and we all do it. Don't let the animals sleep with them in bed. How many cats and dogs jump on the end of the bed, when they're sleeping? It does happen, but again, there's always the risks with it. Now, adolescents. Adolescents are now, all of their teeth are in, all permanent teeth. Now they're going through puberty. The first thing in puberty in girls are little breast buds, and in boys, enlarged testicles. And it goes up to when they're fully developed completely. Okay. We know that the thing with adolescence is all about what Erickson says, and that is establishing an identity. Well, what does that mean? Well, who am I? What am I going to be? Where am I going to go to college? What kids do I hang out with? Do I like girls? Do I like boys? Do I like both? Do I hang out with the band group? It's do I like short hair, long hair, curly hair? Do I like black makeup? Do I like what? Identity, body image. All of this is part of adolescence. Extremely frustrating time of life, trying to figure out who am I? And a lot of emotional stuff goes on, because of that. They are away from the family more than ever now. They are at school, they're at extracurricular activities, dances, they're meeting, going skating, to the movies, to the malls. They're away from family. They're also initiating intimacy that, with the whoever partner they want, the girl, the boy, the both, whatever, hugging, the kissing, and, a lot more that can occur. And again, figuring out, do I want to be a nurse, a doctor, a lawyer? What do I want to be? So the biggest problem is you've got a child who's now turning 12 to 13. Their bodies are changing. They're going through puberty. They're getting breasts, they're getting waist, and they're getting curves, and they're getting pimples, right? They're getting taller. I mean, they go through rapid growth spurts right at that pre-adolescent growth spurt, okay? And the hormones come in like crazy right now. So they have to adjust to all of this. These children now want the privacy by themselves. They're dealing with what's going on. They're aware of the social environments around them, their friends, their non-friends, the groupies, whoever, all, coming at them. The thing with parents is to try to maintain an open communication with these children and letting them verbalize. But adolescents, they start to strive towards independence and they want to do what they want to do when they want to do it because now they're grown up, right? And we know that they still need a little bit more time there. We know that they are the hormones and that sex drive is there. But again, the education there also has to be there. And then what Piaget talks about, and it's also a little bit about Kohlberg in here, about conforming to society, which means doing what society dictates it's right. Whether it's stopping at a red light, whether it's not smoking somewhere if they smoke, whether it is being polite. All of that rules that we don't even think about as adults that we do every day, which is conforming to society. I mean, not doing things that the police is going to pull you over for, right? All of those things. We know that puberty starts earlier than girls and boys. And usually that growth spurt occurs by 18 years old. Now, my son, he's different. He was 5'7" at 19 years old and 147 pounds. He went into the army, was deployed, came back a year and a half later. He was 6'4" and 220 pounds. And I thank goodness that I didn't have to feed him the food that put him that tall and that quickly. It does happen. Sometimes by 18, they are at their height. Sometimes it's a little bit later. Okay. We know that, I mean, and this kid was like this gawky, awkward, arms and legs. I mean, all part of it. Long legs, gangly. And then you dance and your arms or legs are going, and you're like, oh, don't do that. And also, again, acne. And we know body appearance, body image is so important. So that acne is a big deal in adolescence. Now, Tanner, stages of sexual maturity, something that you should be aware about. We know at stage one starts with, you're right before puberty. Then puberty starts. As I said, girls, it's breast buds, and then boys, enlarged testicles. By stages 3, 4, 5, 5 is full adult. All of the body parts, all of the hair. That's what Tanner's stages of sexual maturity is. You can look at a child and where they are, and we can see almost about how old they are by what level of maturity, by how much hair or how big the breasts are, etc. So Piaget thinking, these kids can get a parent to change their mind about anything, where the parent said, no, you can't go out with your buddies and them on Saturday night because you did. Well, what does an adolescent do? Everything they can to change your mind. They get an A on a test. They take out the garbage. They make their bed. They put away their clothes. They know what to do. Nobody taught them. This is all abstract. That means themselves can figure out to fight their way out of a paper bag and get what they want when they want it. That's an adolescent. Okay. They're really scary because they're thinking so much. They know who they are. They understand other people at this point, and they're making their mind up where they want to fit in. We know that their sense of identity, changes. It might be their identity is they want to be in a certain group of kids, maybe the band group, but they decide they want to go to drama, or they want to be a nurse. Oh, now they want to be a lawyer. I mean, all of these things are changing. They're always thinking about what they want. We know their intimacy is going to change. We know that they're going to try things out, and this is all normal. We know culture. Culture always plays a big role in, that sense of intimacy and what they're going to do. And we know always the family's values is going to be there. They're going to sort of make up their own mind now. They don't have to completely conform, but most of them are smart enough not to do something that's going to upset their parents because they don't want to take privileges away from them, do they? And again, body image. They think everybody's looking at them all the time. They walk into a store, they think, oh, they're looking at me. I didn't, my hair, I have a pimple, on my nose. Everybody sees it. Everybody's looking at the pimple on their nose. But these children, adolescents, think it. They like what they do well. Let's say they're in sports and they hit the home run. They're proud as proud, right? Or they're in the band and they got to play a solo. Oh gosh, are they proud of what they do? And they want to be like their peers. They want to fit in to the group, all right? They want to be, not looked at, but be a part of it. So Freud, again, anything sexual, genital, this is all about exploration of sexuality. Erickson, as I said, it's all about identity. Who am I? And what do I want to be? Role confusion, whether it's with the population of kids they hang with or what they want to be when they grow up. Piaget, all about You don't have to, or they didn't have to see something or experience something first. When they want something, they can figure out how to get it. They are now, again, fight their way out of a paper bag to get their needs met. And then Kohlberg is all about now they're following the rules of society, whether it's, where to park the car, where it is, holding a door open, manners, all of these things. We don't think about these things, but this is rules of the society. Parenting of an adolescent is hard. I was actually a single parent when my children were adolescents, and I just held on for the roller coaster ride, as I called it. And I never gave up and I never let go. And it's really difficult because these children, you've got to give them that ability to talk and express themselves to you, but sometimes they just don't know how. So it's, again, trying to maintain it so that the kids don't break off and make bad decisions. Now they're going to make some, but a parent needs to be there in case something happens that they can fall back on them. They still need parents and they still need parenting, and you don't need to be their friend yet. Okay. That's when they're in their 20s. Okay. And now my daughter is my best friend ever, and I'm her best friend ever. But as a teenager, oh no, I still had to have that authority, be able to talk to her and show her the rules and the guidelines. Safety. Remember, biggest safety issue, all age of children, motor vehicles, always, right? Now they're driving. So now I'm really scared. So teaching them driving and what, their responsibility is. And it's not just driving. How about the kids who like to climb on the outside of the cars and go to parking lots and spin around and they fall off and they got road rash and bop their heads and now they've got concussions and brain bleeds. All of those things happen, right? Water safety will always be something there. Okay, all the sports, proper equipment, football, helmets, and a cup for boys, right? Making sure we protect these things. All of these things must be done, protective gear. Remember, females, this female athlete triad, eating, amenorrhea, osteoporosis. Now, females want to be skinny. They're never skinny enough, right? So this is when we worry about anorexia, nervosa, and bulimia. What's the difference? Anorexia, we don't eat at all. We exercise like
Starve
crazy
ourselves.
and you starve. Bulimia nervosa, you eat, but you throw it up, throw it up, throw it up. The one way you can tell which one it is if the teeth are starting to rot. That's the vomiting, the stomach acid, rotting teeth. So that's the thing with both of them, and they both need treatment.
Or they
Something's going
utilize
on.
excessive laxatives to get rid of the
Oh,
food. Yeah.
laxatives, diuretics. Oh,
Yeah.
absolutely. Diet pills, all of these things.
Yeah.
Absolutely. We
Hmm.
also know with adolescents and like gymnastics is one of the big ones. They're so into exercising their bodies, they lose their menses. They're not having their period at all. And that's part of it,
Hmm.
it's something that needs to be looked at. And of course, we always worry about nutrition with their bones and osteoporosis. Adolescents start to experiment a little bit with drugs. We know that um, the big way that we can help stop or decrease the incidence is with education. And it starts in school age, right? School age children are the perfect people to teach. I know my kids went through a
Mama,
program called DARE, Dare to Keep Your Kids Off of
she cut him.
Drugs. And it's something
What do
that
you
we
think?
need to make sure that we are educating our kids and letting them be in those sort of programs. So we know that children, that you adolescents, that you are worried about drug abuse, some of the things you might see is their school grades start to drop. That's one of the big things that you see. Or they're sleeping a lot, or they start to distance themselves, or awake a lot. I mean, both of those things. So pace. the parents, the alcohol, the cigarettes, the education. These are things that we're going to be looking at here. If we have problems with these that we need a referral. I mean, it could be just a referral to a psychologist, could be in one of those programs, Alcoholics Anonymous. Those things actually do work, and they work for families too. Now, some children can go through depression. Remember, adolescents are going through all this body image stuff, right? They're really, really into I'm not pretty enough, I'm not tall enough, I'm too short, too many freckles, whatever it is. All of these things can cause depression. Or it could be I'm not so good in sports and I want to be, or I'm not good in school and you feel less than. Or it could be, one of their friends telling them that they're ugly and stupid and actually put a kid, adolescent, into depression. So,
Professor, can
what,
I ask you a
yeah,
question?
sure.
I'm sorry. Is it common for a patient that has type 2 diabetes to suffer with rheumatoid arthritis as well?
Not necessarily. Not
Oh,
necessarily. Because remember,
so what?
diabetes is an autoimmune disease of the pancreas. And we know rheumatoid arthritis is an autoimmune where the body attacks the joints. It's two separate types of things. I have rheumatoid arthritis.
So can you have a patient with both? Is it not like
Absolutely. Absolutely. You can have them with both.
okay?
You can have them with both, but they're not interrelated. One didn't make the other.
Okay. All
Okay.
right. Thank you.
So, one of the things about depression, any person who threatens suicide, you must take it seriously because adolescents will kill themselves. They will attempt suicide. They will. It's a really high group of suicide. So, what do we need as nurses? I mean, school nurses are instrumental. Recognizing depression, making sure that there's open communication. We're seeing a kid's grades start to fall in school. School nurse pull them in, talk about what's going on. What can I do to help you? Having a poster board, hotlines, pamphlets, all of these things need to be available to those adolescents where they can pull a number or they can speak to a nurse. They don't always have to go to someone. Adolescent pregnancy is a big thing, right? So, what are the problems with it? Well, risk factors are how old are they? Are they 14 or are they 17? Are they 12? I mean, all of these ages, I've seen children, at that age pregnant, and I've seen their babies born in a newborn ICU. The youngest kid I saw was a 10-year-old that had a baby in the newborn ICU. And you see this baby looking at her baby, and I was just new in the newborn ICU, and I was like, okay, and they didn't even know how to touch the infant. So, and that's another thing. So we know that pregnancy, adolescents, we have to make sure that they eat right. Remember, adolescents are too heavy, they're too fat, they don't eat. It's part of their thing too, right? The nutrition isn't where it should be. So making sure they eat good. Looking at sexual activity, making sure they have safe sex, all right? We can, give oral and written information about birth control and where to go to get it. We don't need a parent's permission to do that as school nurses or just nurses. Okay. Unplanned pregnancies, we know that that's a hard thing. We always know that that's going to be your adolescence. And we know that there's those 3 trimesters. And what would an adolescent feel like? Well, first of all, they realize they're pregnant. They don't understand it yet. And now they start to feel that flutter and that second trimester, and now they know it's real. And then on the third, they need to get ready because the baby is coming. As I said, adolescents don't like to eat, right? They get a power bar and a bottle of water, run out the door. They save their lunch money to be able to whatever with it. whether it is to have it so they can buy that shirt they want or go to the movies on the weekend. I mean, they do those sort of things, okay? So they have low calcium, iron, and vitamin B12s because they skip meals and it's just part of it. So their nutrition is really low. And we need to be aware when we start seeing the signs and symptoms of those sort of things. Vegetarian diets. We know that high intake of grains can decrease absorption of iron. So again, iron levels low, energy levels are low. Children that are in sports, adolescents, and if they're in sports as an adolescent, they're taking it really seriously. So they're really, really burning calories and they're exhausting all of those, the glycogen in their muscles. So we need to make sure that they're replacing that, right? They need to know that caffeine and alcohol is just going to deplete their body of the water that they need. And you'd be surprised. Adolescents, a lot of them are trying to get that sports scholarship to get into college, right? Some of them, to be better, are using anabolic steroids. And anabolic steroids can affect not just bones, but the heart and the heart valves and all these other things as they get older. So it is real, it happens. As I said, sex education is part of what nurses need to do. We know that they need to know about sexually transmitted diseases. They know how to prevent sex, getting pregnant. And we can, as I said, give them written and oral information, not our opinion, not to say, well, you shouldn't be having sex, because you tell that to an adolescent, they're going to have sex anyway. So give them the information that they do need. You know, homosexuality, it's what their choice is. It doesn't mean do you like it or not. It's not for us to decide. It's just to listen to what they're saying and to give them guidance. It's like a different culture. You don't have to believe in it. You just have to be able to help that child, right? And experimental, you know, adolescents are experimenting, whether they're experimenting with a girl with another girl or a girl with a guy and a girl or two boys. All of this is experimenting. It's what they do. And we should never condone them for it. We should never tell them, oh, you've done bad things. So the nursing approach, adolescents. Now, we're still adults. Now, I was the older adults, adolescents in an ER, many adolescents that come in. So what I would do, when they come in, I would see something about them. They're listening to music. What are you listening to? What band? Or maybe they had a pair of sneakers on that they knew were the up and coming type. Ooh, where'd you get those sneakers? My grandson or my kid would like that or whatever. So now we've opened up a line of communication. Or they have a New York Yankees hat on. Oh, you like the Yankees? Oh, I like that too. Where you want to go to school? Have you decided what do you want to be? Those things make that adolescent feel less threatened by who you are. You can ask parents to leave the room and speak to the child alone. And as they're talking to you, don't get, they're going to tell you some things that your jaw will drop. Don't act like that. Just let them talk without that response, okay? Because they need somewhere where they can talk honestly and openly so that we can give some good information to them.
That's the same thing we did with mental health when we went to mental health clinic. The same approach we used with them. I used with them, and I got more information. Like you said, some things I would have never imagined. Even the one girl that told us she had an incident on a railroad, we actually looked it up, and it was true. So it's just a
Yeah.
way to do it with that. And even with my 7 children, the boys, believe it or not, were more prone to talk to me than the girls were, except for the youngest girl. But even sometimes with the boys, it's like I gotta kind of like give it to me, let me know what's going on, just so we can make sure that you're okay. And we had one child that did have a baby at 15, but she hid it, so we didn't know for a while.
Yep, yep. And again, if somehow you get on their level, you make yourself less threatening. And if these children, if you have them away from parents and they tell you something, you don't have to tell the parents what they said unless it's something that's going to hurt themselves or others. So, healthcare, nutrition, always, explaining why nutrition is important. Their teeth, dental care, body care. I mean, they love piercings in the tongue. My son came home at 16 with a tongue piercing, and I wanted to shoot him. And then he needed some whatever to flush his mouth out. I didn't have another $10 in my budget for him for his rinse. I said, you didn't think about these things. And piercings and tattoos and whatever. Well, it's always about accident prevention. They're riding their bike, put your helmet on, etc. Talking about substance abuse. Smoking marijuana was the big thing. They all go outside and go to the neighborhood park and get together. And, you talk to them about those stuff and about not taking those good risks. And, then maybe giving them the allowance, for the week and making sure that they're using it properly, right? So again, here we go into theorists. We're talking Freud. It's all psychosexual. Erickson, it's all about how people relate to you and how you relate to others. Piaget is all about how to think, cognitive, right? And Kohlberg is all about right and wrong and doing the right or the wrong thing. So I've really been through these things. And there's, stuff that you can turn on. There's YouTube channels here for you if you want to go back and look, but I think I've covered it really well. So I do have a Cahoots. It's a little long. If it gets too long and you got to go, I understand, but I will start it up and we'll get as far as we can, okay?
Professor, you said it's Kahoot dot what?
Kahoot.it. Hold on, I'm going to show you an easier way to do it, all right? You have a phone, right?
Mm-hmm.
Okay, do you see that code up there? Put your camera on it. It's going to take you right to the website. How was that? Easy? If you can't do it, you go to kahoot.it and use the game pin, which is
I'm in class right now.
631594.
That's much better.
Was that easier?
Yeah, it turns my camera off, so I have to do the Kahoot.it.
Okay, kahoot.it. It's right because you're on your phone right now. If you weren't on your phone, that would be the way to do it. Last year my daughter got married in Mexico, and I was going to the restaurants at the resort, and they had that little code, and those were the menus, and I had no clue how to put it on it and click it. I'm like, where's the menu? They're like, it's on there, do this. And I'm like, you need to show me. So I learned only a year ago how to do this. Let's get going because there's 60 of them. I'm going to try to go quick. I'm going to push it on quick. But if you need to leave, I totally understand. We've had a great class tonight. So a preschool child is asking, why do leaves have trees? Which response would be an example of animism? So animism is all about an animal. So why are the leaves?
I missed the code, Miss Bogart.
631594. So those leaves are there so they can hide. Make sense? Animism. You made an inanimate object
Not
into an
really.
animal. When selecting play activities for healthy 4-year-old, the parent would be guided to understand that they enjoy what? What do 4-year-olds enjoy? So play, 4-year-olds. Remember, preschoolers are that associative, and then you get to be that your toddler is a
Professor, you said
preschooler.
it's okay if we got to go, right?
If you need to go, I understand. Yes. In
Is it
fact,
going to be held against us?
no, it won't in 2 minutes.
Okay. Have a good night.
All right.
I have to
So it
go.
is
I'll text
cooperative.
you. I have to go. I have to go do something. I'll text. I'll email you.
Okay, my dear. So cooperative play is all about your preschoolers, right? There's a goal in the end and they all play together. Cephalocaudal describes development that's what? Remember, what is ceph? Ceph is a head,
Brain.
right?
Yeah.
And caudal is feet. So what's the answer? It's head to toe. That means you lift your head first and then you crawl, you creep, and then you walk. That's cephalocaudal.
They're going so
What
fast.
task would be appropriate to expect a 5-year-old child? I'm trying to go fast so that we can get through as many of these as we can and not keep you over too late. 5-year-old should be able to do what? Remember that initiative. They like to do
Paper
things.
plates.
So yes, give them paper plates. You don't want to give them glass or knives or anything like that, but they'll be able to, without a feeling of guilt, to do those sort of things. A father's concerned about how long his preschool age child will continue to suck his thumb. What is the best response? Well, what did I tell you? When should they stop sucking it?
School age.
Because the permanent teeth start coming in, and we don't want them to get that teeth spread and braces needing. So the answer here is most of them will stop naturally by school age. It just usually happens. And again, part of it is praising them when they're not sucking their thumb. A way a child grows and develops is known as. Some of these are just definitions. And a lot of these definitions you're going to see on your study guide when I give it to you.
Awesome. That's a pretty hard one because it could be growth and development, right?
And the answer is maturation. It's the way you mature.
Wow.
It's the way you mature. Development could be turning over and running and jumping. You mature is the way you grow. Okay. What should the nurse suggest as the most appropriate toy choice for a 3-year-old? So remember always when you talk about toddlers, ages 1 to 3, that's all about safety, isn't it? So which one's a good one for this one?
Push pull top. Or construction set.
A large construction set, but again, it should also say with big pieces. That would be good too. A push-pull toy, and it's a little bit too childish. They're not going to be more to that. Let them explore and build something with it. That's the imagination there. What fear is unique to the preschool period? I think we have what we call dark. We're about fear of being alone and large animals and castration. Those are the big things I believe that are in your book, but it's all about the body or arm. They cut themselves and they bleed, they're going to bleed to death. Their insides are coming out and they're going to die. That's why band-aids are preschool. The age of band-aids. What do abnormal results on a Denver 2 screening test indicate? Now, Denver 2 screening tests are given to children. We're looking at their development. It has nothing to do with IQ. This is not an IQ test. All it's telling you is if there is a decrease in something, they need to find out what it is and they need to do early intervention. Do they need to institute speech therapy, physical therapy? What do they need? You're not where you should be on your growth and development. It's not IQ, it's a need for more. We need to help you more. When planning an activity for a 3-year-old, the nurse bases the plan on the average attention span of how many minutes? How long do you think a 3-year-old is able to sit and listen? And actually, everybody's 5 minutes, about 15
What?
minutes, believe it or not. You can enthrall a child with a book or something. It's about 15 minutes. Now, initially, it's probably 5 minutes, but when they're taught they have to sit, it's usually 15 minutes.
We didn't go over
Remember,
here.
it's the book.
A
A
4-year-old
4-year-old child insists he has more money with a nickel than his father who has a dime. Per Piaget, why is this true? Remember, this is about conservation. So look at a nickel, it's big. And the dime is small. The
artificial.
nickel's bigger.
So he think he got more money. Yeah.
Yeah.
Artificialism. What?
It's intuition. It's intuition. It's
That's good
one's
thing.
big and one's small. He doesn't understand that the smaller one's bigger. It's like, if it's
You
bigger, it
think the
must be
bigger
more.
one worth more?
What should the nurse keep in mind when planning to teach a 4th-grade class about nutrition? So remember, children, school-age children, concrete. Remember, they've seen it and touch it. And once they know it, they can think logically about it. They've seen it, experienced it. Now I can think about it. What do you call a type of family that is traditional? For example, one mother and father and their biologic children. Some of these questions are from last week, and we put them all together to keep these concepts, alert in your mind. And you see some of these in your first exam. And it's called nuclear. It's a nuclear
What's a
family.
communal family, Professor?
Communal would be like a church family.
Oh, okay. Gotcha.
Or let's say you have, for instance, we have the Mexican migrant workers and they all live together. It's that commune. It's that commune or
Okay.
communal.
Okay. Gotcha.
A new mother states she cannot breastfeed her baby. What would you recommend? Well, she can't have breast milk. So what are you going to do?
Iron fortified formulas.
Well, I think it actually depends on how old the child is, right? If the kid was 6 months old, you would say iron fortified formula. If they're a year old, well, that's when you would say they can have whole milk, but it's iron fortified formula.
Yeah.
This probably is talking about the infant. I had problems. I couldn't breastfeed for whatever reason. So I did have to use iron fortified formula. And we need that iron. And that's that reason for that question. An 8-year-old child has frequent nightmares and the parents are concerned. What's the nurse's best response? Do 8-year-olds get nightmares? It's also called night terrors. And it's absolutely normal for children to get
What?
them. Some of them, children never get them, but some kids do get them. And it's because there's something that they're worried or afraid about. And if they're having frequent ones, this is something that a parent needs to talk to them about or have somebody talk to them about. why are they having a nightmare? Something is bothering them, something they don't understand, and they're scared about it. And mutilation is a big thing, okay, at that age. A 10-year-old girl likes school, plays the flute, and plays tennis. What do these activities help develop? 10-year-old, school age, what is that?
Industry, what I can do, what I'm good at.
There you go. Good job. You listen. Perfect. What statement by an 11-year-old child leads the nurse to determine he has moved from the mindset of egocentrism, all about me? Ego. When you talk ego, it's me. That's your toddler, right? Ego. Mine, me, I do. So when you're not egocentric anymore, you're worrying about the other people.
Somebody, other people. You can acknowledge their feelings.
So
yeah.
You're worried about that you hurt somebody's feelings. Yes. The school nurse is preserving a tooth that was knocked out. What will the nurse be especially careful to do? Now, I've seen many a tooth knocked out, and it's when it's the permanent teeth, and it's usually the front teeth up front. So what do? How do we, or do we need to do dentistry in a post and all sorts of expensive stuff? So we don't touch the root of it. We only touch the bottom tip of it, right? And you put it in cold milk and transport it. They can numb the gum, and a dentist can put it back in there and prevent massive dentistry work. It can be done. I've seen it successfully done quite a bit. So hold it only by the crown, not the root. You don't want to damage it with your fingers and your germs on your hands. And cold milk keeps it preserved and ready.
I never knew that.
What term is used for the baby that is up to 4 weeks old? So an infant for 28 days, what are they called? And then after 28 days, up to 1 year, they're an infant. It's a neonate. First 28 days, 4 weeks of life, it's a neonate.
Yeah, that's
After
correct.
that, it's an infant. The nurse is assessing a 13-year-old boy. Which physical change indicates that male puberty has begun? What's the first part of male puberty? I mentioned
facial hair. Is not enlargement of the testicles? Okay. Because I know they'll tell you the facial hair, the deep voice, all of that.
Enlargement of testicles is number one. Girls
okay.
is the institution of breast buds.
Yeah.
That's boys and girls.
Okay, then come the facial hair and the all that other stuff.
Yes. And then it ends up that you have everything. Yes. But those are the only two questions you're always asked. A parent comments that her adolescent daughter seems to be daydreaming a lot. What does this behavior indicate? Daydreaming.
She's trying to get rid of stress? Or she's bored? The teacher needs to come up with better ways to grasp her attention because you have different learners, kinesthetic learners. Oh, she's mentally preparing.
You're thinking about this and that and the other thing. And yes, part of it is that preparation. Yes.
Oh, okay. Didn't know.
The nurse is planning care of an adolescent. What psychosocial task is most important for the adolescent? Remember, psychosocial, Erickson, adolescent. What is it? What are they worried about?
Who am I? What I got going on? Do you like me? Yeah. Who am I gonna
I think it's a sense of identity.
Yeah. Absolutely. It's identity. Excellent. Good job. I explained it well. What does the first tooth generally appear? When?
You mean when does the first one get knocked out and
when does the first tooth generally appear?
Eruption normally takes 6 months.
Oh,
Yes, 6 months. Now, again, it doesn't mean they're going to get a tooth at 6 months, but the book
on
says
average.
generally the first one, 6 months be the earliest. What can the nurse suggest as a good dietary source of zinc for an adolescent who's a vegetarian? My throat.
Zinc. What is zinc found in? I forgot.
It's one of the vitamins that they need in order, for healing and good, bones, many different things. And it's
Nuts.
actually nuts.
It's nuts, yes.
Green leafy
I was
vegetables are
thinking,
iron, right?
yeah,
Yeah.
I
So
think I was thinking fruits.
citrus fruits are vitamin C. It's knowing nutrition and which one is good for what. You will see questions regarding stuff like that.
Yeah.
Zinc is needed for healing, right?
Yes.
A nurse
A
takes
nurse takes the height, weight, and does vital signs on an infant. What level of Maslow's hierarchy and needs is that? Well, remember, we start out with the basics and we go up to esteem. It's that pyramid.
It's physiological need because that's at the base.
It's absolutely what you know is what you have. Everybody has a height, a weight, and vital signs, and that is physiologic. Very good. Yes. At 6 months, solid food is offered. What would be the best choice? At 6 months, we're just starting food, right? So, what do we want to choose? The one that's least allergenic. Of all of these, the least allergenic?
Vegetables.
Oh,
It's
rice cereal.
Rice cereal.
What?
The least
when I was looking in the book,
allergenic
they were
food.
saying introduce
Nope.
rice cereal later.
Nope, it's the first. It's the first one.
Because that's what I
rice
put in
cereal.
mine. Yeah, I was
Yeah.
using rice cereal, and they was like, no, actually, that's what you introduce last. If I find it, I'm gonna send it to you.
From the
Please.
slides, Angie, is rice cereal, the one that we got last week.
Yep. According to Freud, an infant that likes to suck on a pacifier a lot is in which developmental period? Freud. What does he say?
Sexual, oral.
Right. Freud, anything sexual.
He's a pervert.
Yeah, in his own way, I guess. Yes, it's orality. What stages are toddlers in according to Erickson?
Trust and mistrust.
No, that's infants. Autonomy
Oh,
versus
sure. Yeah. On
doubt.
autonomy. Yeah, you're right. You're right.
Automatically me, mine.
Mine.
Yes. And please don't stop me. Let me try. Don't correct me. And I'm not wrong. You tried. Good job. But don't stop me. I need to at least try. What reflex causes an infant to stick their tongue out when you place solid food on it?
It is
Protrusion.
red.
It
Yeah,
is
protrusion.
It's this. When you put the spoon on, they don't know how to do it yet. They only know how to suck, swallow, breathe. And now you're putting a spoon in there, and it's, I don't know what to do with that
Yeah.
thing. A girl tells the nurse, I love Katy Perry and I want to be a singer. This statement is typical of what stage? How old are they when they start this stuff?
I would say maybe late adolescence. It's early adolescence?
Yeah.
Why wouldn't it be late adolescence? I thought early
I
adolescence
wrote,
you're still
yeah.
trying to figure.
I had late too,
One moment
Angela.
here. I thought it
want to
would
be
be
the
like
soccer
more.
player.
I'm
They
still trying
want
to
to be
figure out.
all of
Ricardo,
these
you get it
things.
right?
Yeah, but based on the statement that they made, that I love Katy Perry and I want to be a singer. Based on that tone,
Which
you can
means
tell
your
it's
mind is
early.
made up, right?
Yeah.
It's
No, based on the tone, it's early.
adolescent.
Okay.
Yeah.
Because why wouldn't that be later adolescence? I thought early adolescence, I'm
No,
still
at later
trying to figure
adolescence, they
me
already know
out.
what they want to be. They know if they
Right.
have the ability. It's the younger ones, they're still thinking about, gee, I want to try that. That's, oh, I like her voice. Let me be just like her. And then as they get older, their identity, the later adolescents, they already know what their identity is going to be. It's not going to be a Katy Perry.
Yeah, and that stage, they want to be a lot of things.
An example of therapeutic play activity for a preschool child who's recovering from an appendectomy would be, so you have a child who just had abdominal surgery. Therapeutic play. What does that mean? Something that will help the child. What's going to help a child post abdominal surgery?
Blowing
That's the
bubbles?
answer to this game. No. You're going to blow bubbles,
Yes, it
right?
is blowing bubbles.
That is all about the respiratory. That is also getting that lungs going, and blowing the bubbles help their lungs from getting atelectasis. Very good. The nurse is guiding a parent on techniques of handling a child with enuresis. The most appropriate suggestion would be,
Limit the liquids. Limit what you give them to drink before bed.
absolutely, you're not going to let them drink. No, it's just about 8 o'clock. Again, anybody who has to go may go. If you stay, I'll keep going. The appropriate amount of time
I
to use in
stay.
a timeout period, a 3-year-old child is timeout. What's the rules on them?
Per
1 year
age,
per
per
age year.
3 minutes,
I
but
1
mean,
not
year.
1 minute
um,
per age year. I'm sorry.
That's right.
uh,
It is 3 minutes, 3 years old. Yes. A 4-year-old child is an Erickson stage of preschoolers. Which one is it?
autonomy, Erickson,
Yeah.
preschool identity.
No. That would be, well, yeah,
They want to
autonomy.
help.
Yeah.
They want to help. It is
Initiative.
initiative. They
Oh,
want to help. They want to set the table, but they
initiative
feel
Okay.
guilty when they can't do it or don't know how.
Okay.
initiative versus.
A multi.
Initiative versus
Mom asks if her preschooler can have screen time since her older brother uses the tablet. An appropriate response is,
Should prevent mandatory prevent non-education of screen time surveillance, which prevents surveillance on the program, offering screen time, this environment with text or screen time should be balanced with activity.
the multiple
Yeah,
choice.
yeah.
a little bit
It's
of
all
everything,
of
isn't it?
them. I did
A little
4
bit of
for her to
everything.
6.
Screen time, preschoolers, again, should be limited. And again, it should be educational, not just a bunch of junk. I mean, this is the big thing in today because of, cell phones, and we hand the kid the cell phone to keep them quiet. And they've learned, how to go and use these tablets. So, yes, it's all of these things here.
I'll do
What is
more
the most
when I get a
appropriate
cat.
activity for a 5-year-old child? And I sort of have to disagree with a little bit, but it's riding a
The
tricycle.
tricycle,
I
yeah.
think
Mm-hmm.
yeah, they could do that, but they should ride a bike by 5 at least. A 4-year-old girl tells the father that the flowers are talking and having a tea party. This is an example of what? We're making flowers to talk. What is that?
Animism.
Yeah, that's what I was thinking. Or could it be artificialism? I don't know. Yeah, animism.
Animism.
He's right.
Because we get them to do something. They're in that movement. Yes.
You think it would be more like personification?
Have a good night.
Yeah, that's what I was thinking
See you
too. I was
later.
looking for that word, but I didn't see it.
A 3-year-old seems to
Get
understand
it and
what
get
is
out,
said, but
please.
she just wants something just points. What does a nurse expect? She points. She wants something. She points.
Bye,
What
Miss
are we
Barbara. I gotta
thinking
go to
there?
class.
Go ahead, go. I understand.
Is that
We
normal
just
for a
went over, we
preschool
just had
child?
a very interactive class today. It was a great class. Again, it's
Hey,
expressive
yeah.
language. You know, it doesn't mean they can't hear or any of that. It's just part of, sometimes you talk, sometimes you point. Not a big deal. A group of preschool children sit on chairs placed in two lines to pretend they play on a bus. What type of play is that? We made
Parallel.
chairs
There's no
into
goal.
parallel is toddler play. It's called symbolic functioning. Those two lines of
We
chairs
can go over there.
were a symbol that made up a bus. Okay. The
Oh,
other
okay.
one was animism because they were talking and moving. Okay. A child is 25 pounds at his first visit. The nurse expects him to be approximately what at his 5-year visit? This is a hard question because we know if they're 25 pounds there, they were probably what, 8.5 pounds at birth, 25 at 1 year, at 2.5, about 2.5 should be more like 30 pounds, and then it's
Please
about
go sit
50
down.
Yeah.
at 5-year
Please go
visit.
sit down.
It's
Please.
about normal. You're not going to see a question like that in your exam, so don't worry. Which intervention is considered inappropriate when disciplining a preschool child? And basically, this is how you don't discipline, a child. Remember, the normal thing is giving them a timeout, letting them know what they did wrong. We should never spank a child. We should never hit a child. That's what that means. Which intervention would be appropriate when dealing with a preschooler's sexual curiosity? We had some good questions on this one today, too. Good conversation. And again, it's that correct
Correct terminology.
terminology.
Yeah.
And then we can talk about their sexual curiosity because we know exactly, they know exactly what we're talking about. No miscommunication. The pulse of the school age child is approximately, heart rate should be where? You know, at newborns, it's 140 to 160. And as we get older, it goes down. And by adults, it's 60 to 100, right? So about that 6 to 12, where do you think would be about right? And it's that
Oh
85 to
man.
100. It's a little bit more than adults. They're almost adults, okay? So very close. A multi. What are the benefits to the child of assigning chores to a 12-year-old child? Why would you assign chores?
Responsibility.
Well, we
Studies
know
show
that.
that
Absolutely.
when you assign children chores, they self-esteem. Studies show that when you assign children chores, they tend to be more responsible adults when they get older.
Absolutely. Self-esteem and the responsibility. It's not
Mm-hmm.
about getting the work done and burning energy. No, it's all about what are we doing for the child? We're making them feel better about themselves, and they need some sort of responsibility, whether it's making their bed, putting their clothes away, doing the dishes, putting them away, whatever it is. They need that responsibility.
Mm-hmm.
A multi. A parent asks if it's okay to allow a school age child to play computer games after school every day. The best response is what? I like about keeping them off the streets, right? It's not the answer, though. what it is you challenge their intellect, and it does teach them things. You know, again, it's not that they're allowed to play every day, but you don't want them to play 8 hours a day. They also need to do their chores. They still need to do their homework. They still need to do what they have to do. But yeah, a little bit of time is not bad at all. The parent of an 8-year-old child seeks advice because her child is overweight. What advice should the nurse give? 8-year-old child. We know that school age children that are overweight and we don't work with them, that they become adults that are going to have problems like diabetes and hypertension and high um, lipids in their blood, right? So if the kid's overweight, they still have to eat. Let them be involved. That's what that's all about. Let them plan the meals with you. A 9-year-old practicing the piano has difficulty playing a song. She starts to pound on the keys. The best response is what? Not uncommon. You know, a school age kid, even younger kids, are doing something they can't, and they throw things around, you know, because it's frustrating.
Would it be C? Because you want to validate her feelings and show her, listen, I understand you're frustrated. I understand, you feeling some
That
type of
P
way. Let
sounds
me work
hard.
with
I
you.
see how you
Tell
can
me
be
what's going on. Tell
discouraged.
me what's wrong.
Right.
Right.
Let's try it again. Let's do just the beginning. All right, you got the beginning now. All right, let's practice on the rest.
Yeah,
Very good.
that's what I chose.
Which of the following would be most likely playmate choice for an 8-year-old girl? As I said, according to Freud, remember, what are playmates of school age children?
Oh, Freud, we're thinking sexual. So the opposite gender. The same
Same
sex?
sex peers. He talks about same sex peers at school age as their friends. Yes, he does.
I could have
I
sworn he
know it's
said the
weird of what you
opposite.
would think. I know. Which theory states that the school age child is in time of sexual latency? Well, sex, hello.
We know who that is.
We'll just go right through it. We know that's
Weirdo.
Freud. A child with an allergy to animal dander has asked his parents for a pet. What's the best response from the nurse?
It don't rule out pet ownership, but make sure the pet is immunized, make sure the pet has everything they need, and to teach the child how to properly clean up after the pet.
There you go. And, you know, all of those are part of that answer. Thank you very much. You explained it for me. What are the most appropriate interventions to implement when a child gets his or her tooth knocked out? What do you do?
Put it in milk.
Call
Don't
the
touch it
dentist.
with the
And
root.
if you
Touch it
live
with the
next to a
crown.
pediatric ER, you go to the pediatric ER. I've seen many of teeth knocked out.
I never
Many.
knew until today's lecture they can save the tooth and put it in milk. What
Which
action?
actions can help to prevent obesity? We know there's a lot of school age children that tend to be overweight because it's the age of computer games and not out, you know, running and riding their bikes like it was many years ago, right? So that electronic devices is part of it in this one.
It
So
is?
absolutely. They're sitting playing computers and eating snacks, many of them. So we want them family meals, eating together helps with obesity. Okay. Physical activity and then breakfast. Breakfast is a big, big thing. Most important meal of the day. Just showed it again. Which stage of adolescent development is considered the time of greatest turmoil for most families?
Mm-hmm.
So is it the beginning, the middle, or the end? I know for me, it was very difficult, but it's at 15 to 17. That
Oh
age is when they're
no.
struggling for independence. There's all of this. I'm old enough, I can do, and that's middle adolescent. What is the best food choice for the nurse to recommend an adolescent to eat before an important exam? So it's asking you food groups. Is it carbs? Is it fat? Is it protein? What's the best thing? Because you're putting
Protein,
fuel to the
because you need
brain.
your fuel. Yeah.
It's your fish and
Yay.
rice, believe it or not. Would an adolescent do that? Well, who knows? But it is a great choice. The mom of a 15-year-old girl states that her daughter always believes people are looking at her. What's the best response? And a big pimple on the end of the nose, and everybody's seen it. They're looking only at her nose, right?
That's normal for an adolescent who's looking at me. I'm
Absolutely
looking at them.
normal.
What's going on? Compare
Absolutely
and
normal.
contrast. Yeah.
Which is considered a sign of depression in the adolescent.
Change in school performance.
Absolutely. It's all of a sudden their grades drop, something's going on.
Mm-hmm.
And many times school nurses find these things and pull them in and talk to them. School nurses are very important. A 16-year-old towers over the peers. She says, I hate school. Everybody's staring at me. The best response is
D as in David, because you want to validate her feelings. You want to talk to her. Invalidity doesn't do much.
absolutely. So,
So
why
I'm
does that
learning that
bother
that's
you?
not just with patients, that's with children too, being a parent or a caregiver,
Absolutely.
Professor. Okay.
Absolutely.
Okay, because we did a lot of
Absolutely.
that in introduction to nursing. It was like, oh, always validate the patient feelings and da da
There
da
you
da.
go.
Okay,
Which action
that's
is
with
most
children too.
important when planning nutrition management for the adolescent? So you have a child, an adolescent who is not getting nutrition. When you're planning for this adolescent, how's the best way to do it that the adolescent's going to follow it? And it's always, you know, let's say they need to have a calorie restricted because they're overweight. You still want to put some of their food that they like in there. You can't make it all just carrots and celery, right? You need to
Yeah.
have like a treat every now and then. And that's what that means. And last question, a multi. As the nurse is giving meds, a 17-year-old patient tells the nurse he's never had that pill before. The best action is what? And this doesn't matter the age, could be an adult, could be a child. I've never seen that pill before. What are you going to do? And this has happened to me. Make sure that you check the ID again and check that order. It could be a wrong pill. It could be a wrong pill. And if they're questioning it, it's the safest to stop, don't give it, check it, be sure, and then you can give it, okay? Better safe
Mm-hmm.
than sorry. Okay, good
Mm-hmm.
job, guys. Well, thanks for staying with me. Look at that, Angie. Whoop, whoop, whoop. You did it. Number two, Cardo, good job.
Oh, Cardo won first place this time.
No, Jessica Cardo, and look at that, Karen and me. All right,
I
guys,
have a
great
question.
class. A lot of conversation today,
Yeah.
and I always enjoy those. So, thank you for all of that. Remember that next week's going to be reviews. So look out for when they're coming. If you can't come, I'll put up those recordings for you, and I'll put this recording out soon. Yes, you had a question, Angela.
No, I was done. I was done.
I was asking what we have in next week quiz.
Next week is quiz on
Yeah.
this week's information. You look
Okay.
at that, Cahoots, you're going to be fine.